We always knew that having a child would be a part of our path, and then we kind of experienced some complications with that.
I was told I had a genetic chromosome defect. We had to do IVF in order to make sure we had a healthy baby. When you are high risk, obviously getting a OB is the first step.
Yeah, having a firm delivery plan, right, and making sure that every box was checked along the journey was paramount to us. And also then choosing a healthcare provider during that process was critical.
When they had asked me, well, where should we give birth? Without skipping a beat, I had mentioned it has to be done at Memorial Regional. We have Joe DiMaggio, one of the best children's hospitals in the state of Florida. And although we hope that everything will go well, in case it doesn't, or in case there is complications, there's a NICU here. We have some of the top doctors in the state.
They had had concerns about a possible coarctation of the aorta. The distal end of the aorta looked a little small, and there were concerns that it might narrow further and start to compromise the blood flow to the lower body. Coarctation is it's a big deal.
We navigated this case through the maternal fetal medicine services and the pediatric services, so we really had a full team aware that, when this patient comes in labor, when we're ready to deliver, we need to have sort of everybody on deck to deal with, whatever we need to do for the baby.
I was laying in bed and my water broke. My husband was on a call in his office and I started screaming for him to come in. We got to the hospital around 10 o'clock, scheduled the C-section for 1, and she was born at 1:31.
Unfortunately, during her prenatal care, they did discover that baby Layla had coarctation of the aorta. So she was going to require to be monitored very closely post-delivery.
Once Layla was born and they were able to actually put an echo probe on Layla, they were able to see that in fact there really was a narrow area and it was something that we needed to take care of. To fix the coarctation of the aorta and the arch hypoplasia, the small aortic arch, we actually cut out the part of the aorta that's narrow so it never has a chance to come back, with very good long-term results and very little risk of having to have any other procedures afterwards.
Having the access to so much knowledge and expertise from such a broad range of fields is incredibly valuable for the families that I take care of. Having that available in our own backyard without having to travel, it's an incredible benefit just for the entire community.
Every time we went and saw one of the doctors, right, they were already read in on the situation, so it really helped expedite the level of care. It felt like one cohesive network of people that we were interacting with.
Having that sort of backup team and the whole system behind you, I think is one of the things that makes this one of the best places to practice as an OBGYN, but also for our patients.
It's our culture. It's who we are. It's the fabric of this place. And I think that comes through when you have cases like this.
We were all happy to see her progress and see her flourish into a beautiful young little lady.
She's not even 4 months old. She's already been on this miraculous journey. Just to see her every day smile and laugh is really a miracle.